Hello, welcome back to the channel. Today's report is based on real events that are making headlines and stirring conversation across the country. The South African Human Rights Commission has come out firmly, saying everyone in the country, including undocumented and illegal foreigners, has the right to access healthcare. Stick around till the end to see where we got this information so you can verify it for yourself. And please don't forget to hit the subscribe button and turn on the bell for more real news that matters. Over the past few weeks, South Africa has seen growing tension at clinics, especially in areas where public healthcare is already under pressure. Some community groups and residents have taken it upon themselves to monitor who goes into these facilities. There have even been reports of people being stopped at the entrance of public clinics and asked to produce identification or proof of citizenship before being allowed to seek help. The concern from these groups is that citizens are being pushed to the back of the queue, while people without legal documents are receiving free medical attention using resources that are meant for locals. In response to these incidents, the South African Human Rights Commission has made it very clear access to healthcare is a basic human right in South Africa, and it applies to everyone within the country, whether they are citizens, documented foreign nationals, asylum seekers, refugees, or undocumented individuals. According to the Commission, the Constitution guarantees the right to access healthcare services, and no one, not even clinics or government officials, can deny that to any person based on their immigration status. The SAHRC highlighted that this is not just about regular clinic visits. Emergency medical treatment is a constitutional right and cannot be refused under any circumstance. Even beyond emergencies, the state has a duty to ensure that everyone in the country has access to essential health care, especially vulnerable individuals like pregnant women, children, and those suffering from chronic illnesses. The Commission also warned that any form of discrimination at healthcare facilities, whether it comes from staff or the public, is unconstitutional. They say they are deeply concerned about rising levels of hostility, intimidation, and even threats of violence directed at foreign nationals who try to access clinics. The SAHRC believes that denying people health care not only violates the law but also puts entire communities at risk. In their view, when one group is excluded from medical care, the whole public health system suffers, especially when it comes to preventing the spread of diseases. They've also reminded the public that immigration enforcement is not the responsibility of ordinary citizens or clinic staff. That is the job of Home Affairs and law enforcement. Communities cannot take the law into their own hands or decide who deserves medical attention and who doesn't. Doing so is not only dangerous, it is illegal and could lead to serious consequences. While this message from the SAHRC has received support from many human rights groups, it has also sparked backlash from some members of the public. Many South Africans feel that the healthcare system is already under too much pressure and that the government should focus on fixing the system for its citizens first before extending care to others. There are concerns about overcrowded clinics, long waiting times, and limited resources, and some believe that giving equal access to undocumented individuals is unfair to struggling locals. This debate continues to grow, and it's clear that the country is divided on the issue. But from a legal standpoint, the SAHRC has stated its position clearly. Healthcare is a right, not a privilege, and denying it based on someone's legal status is a direct violation of South African law. All images used in this video were only for illustration purposes. Our sources for this report include public statements from the South African Human Rights Commission, interviews with legal experts, and media reports from reliable outlets like MV News and other South African news agencies. Please take time to verify the details for yourself. Let us know your thoughts in the comments. Should healthcare be limited to citizens only, or does everyone deserve help when they need it? Like this video if you value truth, share it if you want the country to talk about it, and don't forget to subscribe so you never miss what's really going on. See you next time.